Hi everyone, I want to talk about cholera. We've heard about that before. Okay, let's go. Cholera is not a chronic disease. It's an acute disease because if someone has cholera, you can't cope with it for days. No. So it's an acute secretory uh, diarrhea caused by vibrio cholerae. It is a gram-negative toxin producing organism with a lot of strains. Cholera epidemics is very common, particularly a certain period of time in some parts of the world. And it could be endemic in some regions with persistent poor sanitary situations, poor water supply, and poor hygiene. It's caused by vibrio cholerae in situations where it is epidemic or endemic, or vibrio cholerae 0139. In other words, if cholera has been tied to be epidemic or endemic in certain communities, you're likely going to find vibrio cholerae 01 or vibrio cholerae 0139. It is worldwide, with hundreds of thousands of people dying when there is outbreak, particularly in poor environments with poor quality water and sanitation. Traveling to the areas with cholera will lead to its resurgence in advanced parts of the world with well-treated water and food. Transmission. Cholera or its causative agent, vibrio cholerae, could be transmitted feco-orally. That is, anything you put in the mouth that has been contaminated with feces containing this agent will lead to cholera. It is possible to be transmitted readily from person to person. It is very high in children, particularly in endemic regions. And the reason behind that is the low level of immunity and, of course, poor sanitation. Areas with natural disasters like hurricane, flooding, and so on, and war or poverty will likely record more cases than the rest parts of the world. What are the possible risk factors? Contaminated food, poorly treated water, contaminated vegetables or fruits, shellfish consumption, blood group O. Let me explain. I've not said, and I'm not saying, and I would not say that if anyone has blood group O, then the individual will come down with cholera. No. But I will say here unequivocally that if someone with blood group O should come down with cholera, it will be more serious in them compared to blood group A, B, or AB. Hypochlorhydria, that is low-level hydrochloric acid in the stomach, increases the chances of having cholera. Retinol deficiency is bad when it comes to cholera, and breastfeeding, expectedly so, is protective. That's what we call blue death. You've never heard that before? Okay, you could see the background that is blue, right? That doesn't make it blue death. Okay, in cholera, there's a situation called blue death because the skin will turn bluish gray. It's secondary to severe fluid and electrolyte loss, and there's high mortality here. What are the other clinical features? Cholera could be asymptomatic. There's possibility of hypovolemia, that is, a rumbling in the intestine. There's possibility of abdominal pain, or it could be painless, but there will be no tenesmus. Abdominal discomfort is very possible. No, someone just asked me the question that, how do you mean by tenesmus? That is feeling of wanting to defecate immediately after you're done, so you're having that sensation that you're not done. Okay, abdominal discomfort is very possible. Diarrhea here would be with severe and rapid loss of fluid and electrolytes. That would distinguish cholera from the rest causes of diarrhea. Okay, it will be severe and rapid loss of fluid and electrolytes within hours. In fact, people could die within 12 to 24 hours of onset of cholera. Diarrhea with cholera gravis, which means there will be profuse rice, water, stool. Remember, in those days in medical school, if you don't write that, it's not likely I'm going to pass. Profuse rice, water, stool. Diarrhea stool can also contain bile, mucus, and fishy odor. About 20 ml per kilogram per hour of loose stool is going to occur in case, and about 1 liter per hour in adults. You can imagine how massive that would be. Sodium, potassium, bicarbonate are also lost, including chlorine. Vomiting is common before or after diarrhea. As a matter of fact, in some culture, they call it disease that contains two bowls, one for defecation, the other one for vomiting. In severe hypovolemia, you need to look out for sunken eyes, sunken fontanelle, dry lips and dry tongues, skin turgor, low blood pressure, high heart rate or high pulse, low urine output, that is oliguria, and with time will lead to anuria and renal shutdown, or acute kidney injury. Weakness and dizziness. As a matter of fact, when you pick weakness and dizziness, that is going to dictate the level of severity of fluid loss. Pneumonia is possible in children. Glucose may drop, hence there will be hypoglycemia. And with time, the individual could become comatose, and if resuscitation is not embarked upon within hours, the individual could die death. There is a phenomenon called cholera sicca. This is an uncommon type of the disease. The fact that it is uncommon doesn't mean it can occur. So, with this type, the fluid will accumulate in the intestinal lumen, both large and small intestine, leading to hypotension and death even without any external signs or symptoms. In other words, there may be no vomiting, no diarrhea, yet this person is having cholera, but the fluid is being sequestered within the small and large intestine, but there will be obvious signs of hypovolemia. Mortality is very high as 50% and even more, even treated. Diagnosis will be made clinically from history of travel, and the onset of the disease, the severity of it. I've just gone through them. Sudden and severe nature of the diarrhea will be a clue, and rapid deterioration. You can have microscopy culture and sensitivity to be double sure, and you can do stool dipstick or dye field microscopy. Still on diagnosis, you don't have to do a lot of laboratory investigations, but it would be nice to know the level of glucose, complete blood count, electrolytes. You can have your analysis, then check for blood urea nitrogen and creatinine, because when you are having oliguria or anuria, you want to know exactly how the kidney is functioning. Differential diagnosis of watery diarrhea. Okay, that could be heterotoxigenic E. coli or vibrio cholerae 01 or 0139. It could be norovirus, it could be Campylobacter species or hormonal species. If the diarrhea is bloody, it could be Shigella species or Campylobacter. It could be enteroinvasive E. coli or enterohemorrhagic E. coli. It might be Entamoeba histolytica or Schistosoma mansoni. Okay, treatments. The core of the treatment is rehydration. And let me repeat, rehydration. We need less of antibiotics here. We need rehydration. So if the situation is very mild, give oral rehydration therapy or the prepared one, oral rehydration solution. We are going to assess the fluid loss or the fluid deficit, getting our Ringer's lactate or normal saline ready. We have our IV line sets, preparing for IV fluid. The degree of fluid depletion could be determined. So if there's none, that is less than 5% of body weight. So we can just use 5 to calculate the deficit. If there's some degree of depletion, that is about moderate level of depletion, that is about 5 to 10% of body weight. So we can calculate our deficit with 5 to 10%. If we are faced with very severe depletion, that's about greater than 10% of body weight, we're going to use this to calculate the fluid deficit and give appropriately. Like I've just said, you guys are Ringer's lactate or normal saline ready. Ringer's lactate is better compared to normal saline under this situation. Okay, so we can give 30 ml per kilogram over 30 minutes and 100 ml per kilogram over 4 hours, and total of 200 ml per kilogram over 24 hours. We are going to come and reassess this individual after 6 hours. Antibiotics, like I've said earlier, is less useful here, but we are going to use it if we are faced with severe cases. And in that wise, tetracycline will be fine, but not going to be fine if we're dealing with children or even breastfeeding mother and so on. Macrolides could be given to anyone, okay, whether neonates, any age group, or elderly. While fluoroquinolones is not for everybody. Pregnant women cannot take fluoroquinolones, breastfeeding mothers cannot, and children less than 8 years old cannot take fluoroquinolones. Ringer's lactate is better compared to normal saline because it's going to replenish the potassium and bicarbonate that must have been lost. Adequate nutrition and multivitamins will be very helpful here. Prevention. Now, there's a common saying that prevention is cheaper than cure, at least if cure is even attainable. Okay, sanitation. Don't need to waste your time on that. You know what that is all about. Good water supply. If the government is not giving you, you better strive hard to give yourself. Breastfeeding, because it's protective. Cloud filtering of water, okay? And travelers, please, if you are from advanced countries where your water is well treated. When you travel to some other parts of the world and you know their water is, drinking water, anything you do is not well treated, then avoid tap water. Avoid food from street vendors. Avoid raw seafoods. Avoid raw vegetables. And avoid undercooked food items, including watermelon. Other measures will be to treat water with chlorine or iodine. You can have water filtration or water boiling. Vaccines. I will make a separate video on vaccines later on, but just to quickly let you know that it's possible to have cholera vaccines. Though it's not a long time kind of a stuff, but it's going to have within the short time that you'll be in that endemic region. Might be you are visiting or no beloved ones there, or you are on a special assignment like healthcare workers visiting war-ravaged zones of the world or regions with natural disasters. So we have bivalent kill 07 vaccine, and you could be given 2 or 3 doses, WCRVS, and live oral vaccine VCD 103, so and so on. So I'll be going into details later on, but for now, just to let you know, you can have your shot before you embark on that trip if you're afraid of coming down with cholera. And you try your best to prepare your mind that on getting there, I will not just be eating anything anyhow, drinking anything anyhow. Okay, with that, I've come to the end of this cholera presentation. Kindly subscribe to my channel, and you can go through my channel about other acute forms of diarrhea. If you are a subscriber, once I publish my presentation, you will have a copy immediately. Thank you. I appreciate it.